I've been teaching healthcare professionals for almost 30 years. The hardest part of treating a difficult patient isn't always knowing more, it's knowing what to do next. A patient walks into your office with shoulder pain, neck pain, headaches, and low back pain. You evaluate them, you see the postural and movement patterns, you know something isn't right, but what do those findings actually mean? Where do you start? What should you test? What should you treat first? And once you've treated them, what should you strengthen? That's exactly why the MYK brain was built. The MYK brain takes what you observe and turns it into a step by step clinical workflow. You start by entering the patient's postural findings. In most cases, posture narrows the problem to a single nerve level. When more than one possibility exists, the MYK brain guides you through the symptoms and muscle tests needed to narrow it further. Then it shows you the treatment, whether that's a specific adjustment or the muscles along the nerve pathway. It helps you determine which muscles should be strengthened afterwards also. And it gives you a way to document what you found and what you did. The entire process follows 6 steps: observe, analyze, confirm, treat, strengthen, document. So instead of looking at a patient and wondering, what should I do next? You have a clinical system to help guide your next decision. This isn't just a postural analysis software. Inside the MYK brain, you'll find one of the most comprehensive guided posture practice libraries ever built, with more than 1,000 real patient and student postural examples. And it isn't just a library of treatment videos either. It's a clinical decision system designed to take you from what you observe to what you test to what you treat and what you do next. You'll also find assessment guidance, muscle testing videos, step-by-step treatment demonstrations. Everything is designed around one goal: helping you confidently apply the MYK system with real patients in everyday practice. For almost 30 years, I've ended my classes with the same challenge. When you go back to your office on Monday morning, use this, but don't start with your easiest patient. Start with the patient who's frustrating you, the one who isn't responding the way you expected. Use the system, then prove to yourself that it works, because confidence doesn't come from memorizing more information. Confidence comes from getting results. The MYK brain was built to help you start using the MYK system immediately. You don't have to understand every neurological principle before you begin helping patients. And when you're ready to dive deeper into the clinical reasoning behind the system, our home study, live webinar, and in-person courses are there to take you further. So Monday morning or tomorrow morning, try this. Use it on someone who's not responding like they should be. Follow the system, then prove to yourself that it works, because confidence comes from results. Know what to do next with every patient.